Right. Hey everybody, you guys hear me? I'm just going to do a quick sound check. You guys hear? Good. All right. Perfect. Sounds like everything's working. Thanks everybody for joining us at our Valley View University. I'm Dr. Dan O'Connor, and I want to talk to you guys about tendons, primarily tendon injury, and what can we do to keep our tendons healthy. It's just a little bit of an outline of what we're going to go through. I'm going to roughly follow this. We're just going to sort of talk about tendons, tendon injuries, some of their anatomy, their structure, what are the diseases associated with them, how do they get hurt, and then how do we optimize tendon performance and health. What can we do from a training perspective to optimize our musculoskeletal health? And then what are things we can do to recover from tendon injuries? And what can we do from a dietary perspective? And then I'm going to give you guys some time at the end. If anybody has any questions, you can go ahead and put them in the chat. We'll just sort of collect them at the end, and then I'll just go through them and answer them the best we can at the end. A little bit about me. Originally from California, did my undergrad at UC Berkeley, ended up at UC Davis for medical school and orthopedic surgery residency. And then I did a year of subspecialty training at the University of Chicago to do joint replacement and adult reconstruction. And have now been at Valley View for over a year, loving the Valley here. Love fly fishing and hiking and just being outside. It's been a wonderful year. Very happy to be here. All right, let's get to it. So musculoskeletal injuries are the most common complaint in active populations, which tends to be the sort of folks we have here up in the mountains. And more than 50% of all injuries in a sporting environment can sort of be classified as sprains, strains, or ruptures. 30% of all healthcare visits to someone like an orthopedic surgeon or to primary care for musculoskeletal issues are related to tendon injuries. And up until recently, we really haven't had a good sense of how to treat tendon injuries. There's a lot of information, a lot of tradition, and just sort of old advice that is still sort of in the mainstream. It's just what a lot of people expect, and that's how they take care of tendons. But we know that a lot of that is probably misguided. And so what are tendons? Tendons are essentially the attachment from muscle to bone. So muscle is very soft and pliable. Bone is very stiff. So tendons have a difficult job. They attach something very rigid, very stiff to something that is very flexible. And without tendons, you essentially don't have motion in our skeleton. Ligaments are different. They attach stiff to stiff. They attach bone to bone. And so they have very similar characteristics as a tendon, but a very different function. And so we note that a tendon has sort of transitional stiffness. It's soft on the muscle side where it needs to be soft, and it's stiff on the bone side. And then one of the things we notice is that as we begin to train, we get stronger. We develop more force with our muscles. And so our tendons actually have to improve their strength and grow as we train and get stronger. It used to be thought that tendons didn't really change, but that's not true. They change quite a bit. Wherever tendons attach to bone, when the muscle pulls, that tendon can sort of slap into the bone. And so there's a nice cushioning right there. It's called a fat pad, and it's sort of like a little shock absorber. There's really good blood supply in that fat pad. These fat pads can sometimes be a source of inflammation and pain, but they're important to reduce the amount of wear and tear that occurs on tendons where they're attaching to bone. I'm sorry, but I'm going to go into a little bit science. And so tendons are about 80% collagen, which is a protein, mostly type 1 collagen. There's actually 28 different types of collagen. but type 1 is the most common in tendons. There are very few cells relative to what we call the extracellular matrix, the protein that surrounds them. You can see that sort of pink slide that's sort of wavy with some blue dots. The pink is all collagen, and the little blue dots are the cells. That's what a tendon looks like under a microscope. And so there's not a whole lot of cells in there. It's mostly just protein. We do know that tendons, the core of the tendon, it essentially doesn't change very much after the time you're 17. But tendons themselves do grow. They grow peripherally, sort of like the rings on a tree. And so as your muscles get stronger, your tendons have to get stronger, they get bigger, and they grow on the outside. And if you don't use them, then they reduce that sort of circumference. And you can see that tendons are sort of made of these essentially bundles of fibers. And the smallest unit is sort of the collagen fibril. Collagen is a triple helix protein. And essentially, it is the building block for tendons. It's super important in bone, in cartilage, but in the tendon, it is what sort of gives it its structure. Now, tendons don't have a very strong blood supply. We think of things like our heart or our kidneys or our skin. Those have very robust blood supplies, lots of blood vessels to bring nutrients to the tissue. Tendons do not have that robust blood supply. They get most of their nutrients from the synovial fluid that sort of bathes them. And motion is what drives the nutrition. And so as you move a tendon, it sort of undergoes tension. It's like squeezing out a sponge. It squeezes the fluid out of the tendon. And then when you relax, that tendon is able to absorb fluid back in. And so motion is really important for tendons. And so the motion squeezes the fluid out, and then it relaxes, lets new sort of synovial fluid into the cells, and that brings with it the nutrition. That's how the tendons receive their nutrition. And nutrients to a tendon, they're not immediate because it's not in your blood supply. It has to go through this sort of fluid mechanism. It takes about 60 minutes for something that you eat to be seen by your tendons. It's not immediate. It's not quick. It's about an hour. And tendons are something called viscoelastic. They have water in them. And what viscoelastic means is that, sorry, my screen sharing stopped. Sorry about that.
That's okay.
I'm not sure what happened.
Hi, everyone. Sorry.
We're having technical difficulties for any of you there.
Did it kick you off? You see us on there?
Yeah, you're still on there. I think you just have to do the shared screen. Yeah, back to the Zoom.
How do I get that over there? But it's like off on another screen.
The screen share.
It's like over there. All right, well, folks, thanks for hanging in with us.
Go back to Zoom. Oh wait. You see it?
No, because I think it's just general PowerPoint if you open up the file. And do the same thing.
That's the base. So go back.
Um,
Can I try it for a minute?
they're good. I can probably do this without my screen share too, but it won't be as interesting for you all.
Weird that it's not. Do you want to try? Well, should we just finish it out with the?
There's a way for me to navigate it. I can see it.
Just weird that it's not even pulling up.
Like it's on a different desktop. You have multiple desktops. Oh, that's because it's on there. Yep, that's what's going on. Oh, I don't need to plug that in. That's fine. Okay. All right. Let's resume our screen share. All right. Can you see the PowerPoint? All right, we may have figured it out. Thanks everybody for all the patience. Sorry about that. So anyhow, what I was talking about, I think, was tendons are viscoelastic. And what that means is that the speed at which they move dictates their physical properties. And so it's similar to how water behaves. So when you just step into a pool, the water molecules move independently, and you don't even really feel resistance as you step in. They just sort of flow around you. However, when you belly flop off of the high dive, and you hit that water, when you hit it with speed, the water acts as a sheet. That's what gives you that impact. And so tendons are the same. When they move slowly, the different collagen molecules can move independently. When you apply force rapidly, they act all together and they act sort of as a sheet or a cable. And so that's one of the properties that makes tendons very unique. Let's see if I can't navigate. Here we go. And so tendons, the collagen is sort of arranged in these helices. They have this thing called crosslinks, and there's an enzyme, lysoloxidase, that creates enzymatic crosslinks. I've sort of represented those by these little red connections. Okay. There's another type of crosslink called advanced glycation end product. Very big term. All it means is there's sugar molecules that are connecting the different collagens. And those different crosslinks make the tendon stiffer. Okay. And so the more crosslinks you have, the stronger the tendon, but the stiffer the tendon. Okay. And so A diabetic, for instance, they have lots of sugar floating around. They get very stiff tendons. They have much higher rates of tendon injury because their tendons are stiff, and the sugar actually blocks collagen synthesis. Whereas when we train, what we can do is we can get more enzymatic cross-links and more collagen fibers, and that can stiffen and strengthen the tendon. Now, you have probably heard the term tendonitis or tendinosis or tendinopathy. And unfortunately, or maybe fortunately, people get confused as to what this means. And so these terms are often used interchangeably. People don't differentiate what they mean. Tendonitis, itis meaning inflammation, typically refers to sort of acute injury and inflammation. Let's say you haven't worked out in a while, you go back, you hit the gym, you hit it too hard, and the next day you're sore. Your knees hurt, your elbows hurt, that sort of thing. That's that acute inflammation, the acute overdoing it. That's what we call tendonitis. Now, if tendon injury is persistent, so it lasts over time, something like on the orders of weeks, then it's a chronic tendon injury. There is actually not much inflammation in it, and we call this tendinosis. Now, because these two terms are similar, but a little confusing, we use another term called tendinopathy. That just means disease state of a tendon. It doesn't differentiate acute versus chronic, inflammation, no inflammation. It's sort of a catch-all term. So when you hear somebody use these terms, they may be using them appropriately, or they may not be. The nice thing is that for training purposes, it doesn't really matter which one we're talking about because the treatment's going to be about the same. Now, jerk is something, it's a word that probably has an emotion attached to it. There's somebody who you cut you off on 82 or something, and you felt like saying, oh, that jerk. It's got this negative connotation, but jerk is actually an engineering and physics term. And what it means is it's the change in acceleration. So velocity is the change in position over time. Acceleration is how fast your velocity is changing. And jerk is how fast the acceleration is changing. Jerk is what creates the tendon damage, both microscopically and macroscopically, okay? And some sports have really high jerk. Things like football, basketball, moguls, soccer, golf. And some have very low jerk. Think of things that are smooth, cycling, swimming, hiking, sort of a low impact things. And this, it's essentially, it's not the fall that hurts, it's the landing. It's the sudden change in acceleration. And that's what damages tendons. If it's really big jerk, you can have a complete tendon tear. It's like your pants split right down the middle. But if it's sort of more chronic, small jerks, that's like tendon damage. That's sort of like just wearing out the knees in your jeans over time. It didn't happen all at once. It just happened a little bit of damage over time. The difference between your genes and tendons is that tendons have the ability to heal, that your genes do not. And we also talk about muscle pulls. Muscle pulls are essentially a healthy tendon acts as a shock absorber to protect muscle. Think of like riding in a really nice car with good suspension. You can go over bumps and you really don't feel it. You've got a good shock absorber. But if you have really stiff suspension, a really old Jeep or something, you'll feel every bump in the road, okay? Same thing, a healthy tendon acts as a shock absorber. A stiff tendon does not. It doesn't shield that muscle. And so when the force that a muscle sort of is up against, when that tendon is stiffer than the muscle is strong, then the muscle will actually pull apart. And an interesting thing is that stiff tendons improve performance, athletic performance, because they don't absorb shock, they don't stretch, but this can increase your risk of injury, okay? And an interesting thing that most people don't think about is that stretching before sports does not decrease your rate of muscle pulls. Almost every high school football game you ever go to, they do this warm-up where they do their stretching routine. It doesn't protect from muscle pulls, and it may actually decrease performance because when you're doing no stretching, you're stretching the muscle, you're not actually stretching the tendon. And this is sort of an image of tendinosis. This is a chronic tendon injury. Think of this as like jumper's knee. Basketball players, about 75% of them have this injury. And you can see just here in this in the circle, you see this black tendon, that's the patellar tendon, and this white stuff at the bottom of the patella. That's that signal. That's actually damaged tendon over time. There's not very much inflammation in there. And then this particular patient underwent a training program that was able to reduce that over time. Now, we talked about tendon stiffness affecting performance. The reason that is a stiff tendon transmits all that force from the muscle directly to the bone. You can generate force very fast, okay? Whereas a tendon that's less stiff, that has some stretchiness to it, think of like a rubber band versus a metal cable. If you pull on the end of the rubber band, it's got a little give before it pulls the object. Whereas you pull on a metal wire, the thing moves right away. Oh, sorry, more technical difficulties. Oh, we're way past that. Okay. And so, let's see. We one more here. And so sprinters, like Olympic sprinters, they want high performance, okay? They're trying to generate maximum speed. And so they want very stiff tendons. They want really efficient force from the muscle to the bone. And so they train in a way to make very stiff tendons, which makes them very fast. However, it also increases their risk of injury. There's a huge increase in the risk of hamstring pulls at sort of championship level sprinting. They've been working on performance up to the peak of their sport, but that's right when they end up having these muscle tears. But exercises that are slow rather than fast allow the tendons to stretch. They allow them to break those cross links and become less stiff. And so I like to think that stiff is fast and stretchy is slow, and vice versa. If you do things fast, you'll create stiff tendons. If you do things slow, you'll have stretchy tendons. And that's going to talk a little bit more about training. Let's see. So how do we train our tendons for health? So there's a balance between performance and health. Most of us are not Olympic level athletes. Some of us might be. And so there's a balance of how stiff do you want your tendons and how stretchy do you want them. For me, I'm not competing at a high level. I need more tendon health rather than athletic performance. And so what we know is that just like we talked about, like the high dive and hitting the water, if you go fast, all those collagen molecules act as a sheet. If you go slow, then they can actually act individually. You can actually get the tendon to stretch or creep. This is kind of like rock climbers when they're on a rope and they lose their hold and they fall. When that rope first hits, it stops them very abruptly. But if they sit there under tension over time, that rope will actually lengthen, okay? It's similar to sort of that stepping into water slowly versus hitting it very hard. The same thing happens with our tendons. And so one of the things about tendon injury is that you're constantly getting these little tears in the tendon. What a scar is unorganized collagen fibers. They're not what we call directionally oriented. They're just in random directions. And one of the things that can happen is that when you have a tendon injury, you have part of it that's injured. The healthy stuff on the outside takes all the force. And what it does is it shields the damaged portion of the tendon from receiving tension. And that does a couple of things. One, those cells in that damaged region don't have a force to help them orient the direction that they build these fibers. So they just sort of build them in all directions. The other thing that happens is the outside healthy tendon, as you stretch it, they actually squeeze the damaged tendon causing compression, and they can actually tell those cells to stop making tendon and to make cartilage. Cartilage is very good under compression in your knees or your hips, for instance. And so chronic injury to a tendon can actually cause those tendon cells to make cartilage rather than tendon fibers. And so how do we train? How do we train to get these tendons to heal? And how do we train not to have injury? The main goal is this, is if you're looking for stretchy tendons, low risk of injury, sort of tendon health and tendon healing, what you want to do is apply either very slow or very still, like isometric exercise with moderate to heavy load. And what that's going to do is over time, that allows the healthy tendon to stretch out. It breaks some of those cross links, and the tendon becomes more pliable, okay? That tension also gives the cells the directional signal to make collagen in a sort of a parallel direction to the force. That's what a healthy tendon does. The interesting thing about these cells in your tendon is you can only stimulate them for 10 minutes, and then they don't care what you say to them. They're not listening to you, kind of like a teenager. It takes about 6 hours for those cells to reset, for you to be able to give them a new signal that they'll respond to. And so sort of optimum exercise, and it doesn't matter what tendon we're talking about, whether it's your patellar tendon or biceps tendon in your hand, in your Achilles tendon, all of them, it's very similar. What you want to do is do an isometric, relatively heavyweight hold for 30 seconds. And you want to do, and then take a break and do another 30 seconds and do that for 10 minutes, short period of exercise, and then rest for 6 hours, okay, at least 6 hours. And what this does is this allows those 30 seconds, the stress relaxation occurs, the tendons lengthen, you give the damaged tendon an appropriate signal to make collagen in the correct orientation, and it breaks cross links. It makes those tendons more pliable, less stiff, which allows the tendon to act as that shock absorber to protect your muscle from injury. And so weight training is an important component of tendon health. So even for our long distance runners, for instance, weight training is an important part to prevent injury. Long distance runners get a lot of Achilles tendon issues, a lot of heel pain issues. And so they should do exercises where, a lot of therapists love to do the eccentric, where you lengthen the tendon slowly. That's great, but it's actually the slow that matters. It's not that you're lengthening the muscle. And so you should do like a heel raise and just hold it for 30 seconds under heavy weight. And do that on a regular basis, and you're actually going to get healing of that Achilles tendon. And it just applies to all of our tendons. And so if you have a particular sport exercise that you do, or you have a particular tendon issue, you just say, okay, well, what does this tendon do? And then find an exercise that stresses that, do it under relatively heavy load, and then just hold it. You don't have to move. You just have to be isometric, hold it for 30 seconds. Just do it for 10 minutes, and then you got to give it a break, 6 hours or so. Now, when we talk about tendons, we also want to think about sort of dietary considerations. My thought is that you should think food first, supplements second. If you can get your appropriate nutrition with a healthy diet, that's what you should do. If you need to supplement it, then of course you can do that. And these are some of the things we're going to talk about: copper, vitamin C, proline, gelatin, glycine, anti-inflammatories, and things like whey protein. And so copper is a vital element for collagen cross-linking. We know that deficient copper levels leads to weaker tendons. The interesting thing is, if you hit sort of the baseline level of copper, adding more copper doesn't help you at all. And so more is not always better with copper. Enough is as good as too much. And so for most people, getting appropriate copper is not an issue unless they're on very strict diets. And it is important. Next, we talk about vitamin C. So vitamin C is a very interesting molecule. It's an antioxidant. It has anti-inflammatory properties, and it is absolutely vital for collagen formation. The lack of vitamin C causes scurvy, just like the sailors and the pirates used to get. And because they can't form collagen, they have skin problems, tooth loss problems, old wounds open up. One of the first nutritional studies ever recorded was actually in the British Navy. A Scottish physician had 12 sailors with scurvy, and he thought that acid was going to cure everything. So he gave 2 of them cider, 2 of them sulfuric acid, 2 of them vinegar, 2 of them seawater, and 2 of them 2 oranges and a lemon. And the guys that got the citrus recovered in 6 days, and the other guys did not recover at all. Vitamin C is absolutely crucial for collagen formation. It is water soluble, and so if you take vitamin C and you have more than you need, your body, you're just going to pee it out. And so there's very low risk for overdose of vitamin C. It also, like we talked about, does do antioxidant and anti-inflammatory effects, but it is absolutely vital. Tendons are about 40% glycine, which is an amino acid by weight. We do know that glycine supplementation can improve collagen synthesis. Gelatin, like from Jell-O, is essentially collagen. It's boiled collagen from typically beef or pigs or fish. It's very high in glycine, and it makes sense. If you're trying to build tendon, what should you feed your tendons? Well, you should feed them tendons. And the interesting thing is that the amino acids in gelatin are actually incorporated much faster into your tendons in gelatin form than if you just take the amino acids separately. We know that consuming 15 grams of gelatin relative to not consuming any results in twice as much collagen synthesis in your body. We know that 30 grams of collagen is even better than 15 grams. You can find all kinds of gelatin or collagen supplements. It is an animal product. And so for vegans, sometimes you have to try and find those amino acids in a different form. But certainly the most effective and efficient is through gelatin or through collagen. Collagen is essentially gelatin that's been treated. It's either been treated with boiling or acid. One of the things that does is it breaks it into little pieces, and so it's more soluble in water. It's the #1 fastest growing supplement in America. There's about $45 million of sales of collagen supplements. It's marketed for everything from teeth, skin, hair, nails, and I'm marketing it for tendon function. We know that collagen supplementation can, over the long term, can actually increase the thickness of the cartilage in your knee, for those of you who have knee arthritis. It lowers your knee pain, and it actually has an interesting effect that it seems to also improve mood and physical and emotional functioning over time. We're not exactly sure, is that just because you hurt less and so you feel better, or what's going on with that? But there's been a huge uptick in sort of collagen supplementation and a movement behind that. And so, you know, for tendon health, it's very important. A lot of people ask about anti-inflammatory diets, different supplements like turmeric or arginine, a bunch of different things. And the interesting thing is that tendons themselves have very little inflammation, even in tendinitis. The tendon itself has very low levels of inflammation. We know that if you block inflammation, that it doesn't actually seem to change the tendon function. And so while anti-inflammatory diets or supplements may make you feel better, probably because they're affecting that fat pad, which is right near that tendon, you're not actually changing the structure of the tendon. You're not saving it from inflammation or anything like that. And so there's still some controversy of inflammation is important for the growth of tendons, and so we don't want to block it completely. But it doesn't seem as though most of the inflammation supplements really make a very large difference when it comes to tendon healing. Another thing people will talk about is whey protein. This is a protein supplement that is actually very, very good for bone and muscle formation. It does not, however, increase your collagen synthesis. It's probably just not quite the right mix of amino acids. And so it's another supplement a lot of people like to take. I think it's great when you're trying to talk about bone mass and muscle mass, but it does not seem to have a significant effect on tendons. It's certainly not better than gelatin or collagen. When we talk about tendons, sometimes we talk about injuries, and we sometimes go to the doc, and historically we end up with immobilization. Interestingly, we know that immobilization is not good for tendons. We talked about how tendons have to move in order to exchange nutrients. And so they did a study where they immobilized the mouse ankle for 3 days. And in 3 days, they had a 20% decrease in collagen in the tendon and a 5% muscle loss with scar formation in the tendon in 3 days. So this shows us that tendons are very dynamic. They change quite quickly over time. They're very sensitive to immobilization. Interestingly, the first sort of cast or splint that's sort of recorded in history was found in Egypt about 2500 BC. It's interesting that the medical community is still using sort of 5,000-year-old technology, and you wouldn't really necessarily accept that in any other sort of corporation or operation, but in medicine, it seems to be stick around. Now, sometimes immobilization can be needed. So when we're not talking about a chronic injury, but we're talking about a complete. We do know that that causes tendon weakening. It causes collagen loss. And if you don't medically need it, you should avoid immobilization. Hand surgeons happen to know this very well. After they do tendon surgery in the hand, they try and get you moving right away. And so the sooner you can get moving, the better when it comes to tendon function and healing. And so what's sort of the summary of this whole thing? A good training and diet supplementation for tendon healing and health is to do 20 to 30 grams of collagen or gelatin with vitamin C, and 60 minutes later, do your tendon training. Your tendon training should involve a heavy weight with slow movement or isometrics. You don't have to move at all. And you want to hold for 20 to 30 seconds. That allows about 85% of the relaxation of the tendon. And you should do this for about 10 minutes. After 10 minutes, continuing to do the exercise doesn't improve your tendon health. And so we recommend short bouts of exercise with long periods of rest. This is similar to how we talk about training muscles, but and then another thing we noticed that caffeine can inhibit tendon synthesis. And so initially they did a lot of these studies in high-level athletes, and they just mixed the collagen into their coffee, and they didn't see a big improvement. And it turns out that the caffeine has some inhibitory effects. And so if you're a big coffee drinker or using caffeine as a workout supplement, you may want to space that out from your sort of tendon training time periods. And if you can, avoid immobilization. So when you sprain your ankle, your ankle hurts, it's swollen, but you're probably better off doing early range of motion than you are being in a boot for a prolonged period of time. So unless your orthopedic surgeon says, nope, you have a fracture or you tore something, immobilization is something that you should try to avoid if you can. And when it comes to training, we have to balance performance versus health. If you're an elite level athlete and you're looking for optimum performance, you want to go light and fast, and that is going to make stiff tendons, and that's going to make your performance higher. It will increase your risk of having an injury. If you're looking for more sort of health, then you want to do exercises that are slow and heavy for short periods of time with long periods of rest. This is going to result in a stretchy, pliable tendon that acts as a good shock absorber that is able to heal the damaged scar that occurs from wear and tear, and that's able to protect those muscles from injury. if you want more tendon science, there's this guy, Keith Barr, who is from UC Davis. He actually came to speak to us in residency. He is the sort of preeminent tendon ligament scientist. He's on tons of podcasts if you want to get sort of his version of this. And he's done an incredible amount of research designing tendons and ligaments. And he has lots of good information. A lot of what I shared is related to his work. With that, I want to thank you all for sticking with us through all these technical difficulties. And I'd love to take any questions or concerns that you all have. I'm going to try and stop my screen share, and we'll just try and do some questions if there are any. All right.
Hi, Dr. O'Connor. All right, first question that came from one of the emails actually prior to the lecture. Can tendon healing protocol help with hip or groin pain, especially with walking, weight bearing, and getting up from a seated position?
So that's an interesting question. Can tendon protocols help with groin pain, getting up from a seated and standing position? It depends a little bit on the etiology. Why are you having those pains? The interesting thing is that we know that exercise is good for arthritis. It improves your pain and function. And so exercise in itself is great. It is very important for overall well-being and health. How you train your muscles versus how you train your tendons can be a little bit different. And so if it's determined that it's a tendon issue, what you can do is you can work with a therapist to say, okay, what tendon is bothering me? How do I load that? How do I do isometrics? So I'm not moving the joint, I'm holding still, and I'm going to hold that for 30 seconds. And just do that for 10 minutes. And over time, that can improve that pain that may be being caused by sort of repetitive tendon injury, often around the hip.
Okay, and question number 2, I think, is very much along the same lines and probably has a similar answer. Can tendon healing protocol help with posterior hip pain that is experienced after a hip replacement?
So certainly. So we talked about how tendons get damaged over time, just with jerk, with the sudden movement. But you can also have other injuries. You can have lacerations or you can have surgery, and those can cause injury. And as you heal, you get a scar formation. And that's sort of disorganized collagen fibers. And doing an isometric heavyweight training protocol with collagen supplementation can actually get those cells to sense the tension appropriately and reorganize and sort of change that scar tissue into a more functional tendon state. And so it certainly does have a role in surgery recovery and injury recovery.
Perfect. Another question, how does this protocol affect people with tissue disorders like Ehlers-Danlos syndrome?
Okay, so Ehlers-Danlos syndrome is a disorder of the collagen and collagen formation. And so I don't know the specifics on Ehlers-Danlos as to how their collagen system is affected in these training environments. I don't think that study's been done. But I would hypothesize that in patients who, in Ehlers-Danlos, they often have loose ligaments, which are a little bit different than tendons. You want your ligaments to be very stiff. You want your tendons to be very stretchy. And so fast motion is actually good for ligaments. It will increase the cross-linking. Exercise that's fast will cause stiffer tendons and more stable joints. However, when you're doing those exercises, you're likely also going to be stiffening your tendon. And so what you can do is you can combine those training approaches. You can do fast, high-performance exercises, which is good for muscle and ligament, but then you should also have a separate tendon training protocol to try and avoid tendon injury. And that's more of the slow isometric training.
Okay, and this last one is 2 parts and came during the presentation. What's the difference between synovial fluid and the fluid in fascia? And does massage help to move nutrients from fascial fluid?
That's an interesting one. So, synovial fluid, we often talk about it in terms of joints, being in a joint, but it also runs along sort of the membranes around many tendons. And so it's essentially the same fluid. We just call it extracellular fluid. The way that tendons sort of get that nutrients we talked about is motion. And so you apply tension to the tendon, it squeezes that fluid out, you relax the tendon, and it sucks that nutrient-rich fluid back in. That's how it sort of receives its nutrition. And so theoretically, if you could get a massage to express the fluid from that tendon and then relax, you could potentially increase that nutrition to the tendon. I think the challenge is going to be being able to apply enough force to do so, because most likely what you're going to do is just move the tendon out of the way. Typically, it's the tension in the tendon rather than squeezing the tendon that is going to do more of that fluid driving. So there's a chance that that would help. I think it would just be less effective than just motion of the tendon itself. All righty, wonderful. I think that's all the questions that we had for this evening. Actually, there's a couple more questions. There was a question, does glutamine and chondroitin help? Those are amino acids that are more commonly utilized for cartilage rather than tendon function. And so there is some evidence that chondroitin sulfate, chondroitin comes in sort of two forms, chondroitin sulfate and chondroitin hydrochloride. There's much better evidence to support the sulfate formulation, and it does seem to improve cartilage thickness somewhat. Collagen itself supplementation increases your cartilage thickness and decreases knee pain, so that can work well. As far as how does glutamine or glucosamine and chondroitin help tendon function, I don't think that that's been specifically studied. That's more of an intervention for cartilage. And then let's see. We have a question about biceps tendonitis. And so essentially, how can we work on that? One of the things we can do for the bicep is sometimes that there's big tears in the bicep, but if it's more of the chronic tendon tears, those what you want to do is find an exercise that stresses that bicep. So for instance, a bicep curl with a heavy weight where you're not doing a bunch of reps, but you're just holding it still. And you want to hold it for 30 seconds and then rest, and then hold for 30 seconds and rest. Do that for 10 minutes with collagen supplementation, and that can improve biceps tendon pain. Another question is, how does collagen or gelatin protein differ from general protein? Proteins are all made of amino acids in different combinations, and that's what gives the proteins their shape and consistency. And so gelatin is essentially just collagen protein broken down. And so it has all the little building blocks you need to build a tendon or to build collagen. And so gelatin or collagen peptides are specifically like the right amount, the right concentrations and ratios of the different amino acids. Whereas general protein, such as whey protein, it provides lots of amino acids, but it's not as specific for tendon building. And so general protein can be very helpful for muscle building, but not necessarily for tendon function. And then there was a question about, does the tendon protocol help where the tendon connects to the bone? It can. It is important to do that sort of heavyweight isometrics. A lot of times the pain that you experience is actually from fat pad impingement. We talked about that little shock absorber between the bone and the tendon. So when the tendon pulls, it sort of slaps against the bone, and that fat pad absorbs that shock. Our shock absorber in our bodies is fat, and it does a very good job of doing that. Sometimes you can get inflammation that's going on there in that fat pad, and it can secrete different chemicals around the tendon that can damage it. And so the nice thing about the isometric, meaning not moving, heavyweight protocols, is that there's not that impact of the fat pads. You're not going to worsen it as you would with something that's fast or light. And so doing sort of slower exercises can optimize that tendon healing without exacerbating that insertional pain. Another, someone asked about, what about cadaver tendon? So sometimes when we have injuries, a tendon reconstruction is performed. And I think it's not 100% clear as to how much revitalization occurs in a graft. I think at the ends of it, there's some evidence that you do get cell migration into it and can get some remodeling. But because most of the tendon does not have living cells, they're not going to respond to stress the same way. They're not going to respond to nutrients the same way, and they may not sort of respond to exercise in the same way. And so I think at the ends of that graft, where there's a better chance of cells sort of moving in from your own tissue, there's a chance that you can get that effect. But I think in the rest of it, it's probably unlikely that you would get a significant healing in that portion of the tendon, but I won't say it's impossible. I think it's certainly possible. And I think that's all the questions. Thanks everybody for sticking with us. I guess to summarize, move slow, heavy, vitamin C and collagen, and that can promote excellent tendon health. I think pretty shortly we're going to have our 2024 Valley View University program. And so if any of you have ideas or suggestions or topics you would like addressed, please feel free to leave them on the Facebook page or email. And we'd love to address those if we can. Thank you all for your time. I hope this was helpful. Have a good evening.